is Lily, and I'm going to be your PA student today, okay? I'm just going to be performing your physical exam. Before we get started, though, I'm just going to wash my hands, okay? Right, I'm going to start by getting your blood pressure, so good. Uncross, sit up straight for me. And I'm just going to hold your arm under mine. Everything looks good. I'm now just going to get your heart rate, okay? If I can see your wrist. At the same time that I got your heart rate, I also got your respiratory rate, okay? At this time, I would have gotten your temperature and your oxygen, but we don't have that available to us right now. So I'm going to ask you, how much do you weigh?
17 pounds.
Okay, and how tall are you?
I'm 5'2".
Okay. All right, I'm going to put that in and calculate your BMI, okay? I'm now going to perform a general survey, so I'm just going to look at your overall appearance, your state of health and hygiene, if you're in any distress or pain, if you're in any emotional distress, if you're in any distress or pain, and your level of consciousness, okay? All right, so now I'm going to perform the skin exam. So first I'm just going to inspect your skin, but while I inspect, I'm also going to palpate with the back of my hands, noting temperature, texture, moisture, okay?
Now I'm going to do your visual acuity test.
Okay, other side. Okay, and if you could lower the front of your gown for me, I'm just going to get your chest, okay? Okay, if you could lift it up. Thank you. Okay, you can stand up for me. I'm just going to get the fronts of your legs with both of my hands. Okay, turn around. Backs and the back of your chest. Okay, you can sit back down for me. I'm now going to get your feet, so if I could have your feet up here, again, I'm just going to look at the top of them, make sure everything's okay, observe the bottom of each. I'm also going to look in between each toe. While I'm also at your feet, I'm going to look at your toenails and just assess them for texture and also capillary refill. Perfect. Okay, do your fingernails as well, same thing, inspecting them and feeling for any texture, and also performing capillary refill. Okay, now I'm going to do your skin or your hair exam. So first I'm just going to inspect your hair, looking at the hairline. Okay, now I'm going to palpate, noting for texture, quantity, and distribution. Is it okay if I touch your hair and look through it?
Yes.
Thank you. So again, just looking all around at the scalp. Okay. Okay. Now I'm going to inspect your head. So first I'm just going to look and make sure there's no gross abnormalities. And then next I'm going to palpate in certain areas. So let me know if this brings you any pain if I palpate somewhere, okay? Is that okay?
Yes.
Okay, is that okay?
Mm-hmm.
All right. Now I'm going to perform your eye exam. So first I'm going to hold my finger in front of you, and I want you to look at my finger and then look at the wall back there, okay?
Okay.
So look at my finger and look at the wall. Look at my finger and look at the wall. Now look at my finger and follow it all the way in. Perfect. Now keep your head still. Follow my finger with just your eyes. Now I'm gonna inspect your inner conjunctiva, so it's okay if I pull up on your eyelids and down just to
Yes.
look? Okay. So you could look up for me, down, left, right. Okay. Give you a minute, and then we're gonna pull the bottom and do the same thing. Up, down, left, right. Okay, perfect. Now I am going to shine a light in your eye. I just want you to stare at my face, okay? I'm just gonna look at your irises. Okay. Now I'm gonna do 4 quick flashes in your eyes. Again, just look at my face, okay? Is it okay if I hold my hand in front of your face? Perfect. Okay. Now I'm gonna perform the eye exam. So I'm gonna stand about 6 feet away from you and hold the chart in front of your face. If you could cover your eye with the palm of your hand, okay?
Okay.
Do you wear glasses or contacts?
I do not.
Can you read this line?
OLCF DHJ BS EPTZO CFDHJ LTFFH.
Okay. If you could do the other side for me. Could you read this line?
EPTZO CFDHJ LTFEH.
Great. I'm now just going to stand in front of you, and I want you to cover one of your eyes while looking at my face. I'm going to be holding up numbers in your peripheral vision. If you could tell me what those numbers are, okay?
Okay.
So cover up this eye for me, and I'll do the same. Okay, look at my face. Could you see that?
Yes, ma'am.
Okay.
1, 2, 2,
Okay, and then switch.
1, 2, 4, 2.
Alright. Now I'm going to perform the fundoscopic exam. At this time, I would turn the lights off. We currently can't do that. Okay, if you could hold this under your arm for me, perfect. I want you to stare at the back wall for me. I'm just going to shine a light and move in closer to your eye. I'm just going to rest my hand on your forehead as well, okay?
Okay.
Okay, red light reflex. Perfect. Okay, other side, same thing. Perfect. Okay. Now I'm going to perform the ear exam. So I'm just going to observe the external portion of your ear, noting to look behind it. At this time, I'm also going to perform the tug test. I'm just going to pull on your ear. Let me know if this brings you any pain.
No.
Is this okay?
Yes.
Okay. I'm going to stand behind you, and I want you to occlude one of your ears. I'm going to repeat a series of 3 numbers and letters, and I want you to repeat them back to me, okay?
Okay.
1, 2, 8.
1, 2, 8.
Okay, you gonna do the other side? 5, 6,
5, 6, 4.
perfect. Okay, I'm now going to look inside of your ears, okay? And this is a clean tip. Again, hold this under your arm for me, perfect. Okay. I'm just gonna pull in the back of your ear so I can get a better look inside. Everything looks good. I'm now going to observe your external nose, noting if there's any abnormalities. Okay. Now I'm going to look inside of your nose, and if you could lean back just a little bit and lift your head up, and just to help, I'm going to pull up on the tip of your nose, okay?
Okay.
Same thing. I'm just gonna put this under your arm. And while I perform this, if you could breathe through your mouth for me, that would help. Okay. Now if you can include one nostril, breathe in and out for me. Okay, other side. Perfect. Okay, now I'm going to observe your external mouth, noting if there's any abnormalities. Okay, and if you could open your mouth for me, just going to observe the inside. Stick your tongue out for me and say ah. Perfect. Okay, if you could lift your tongue onto the roof of your mouth, also looking inside your cheeks. Okay, I'm just observing cranial nerve 12, 9, and 10. All right, now I'm going to inspect your neck. So first noting if there's any abnormalities, and I'm just going to palpate, feeling for normal anatomy. Okay. Now I'm going to palpate your thyroid. So the easiest way for me to do this is if you turn to the side and I wrap your hands around your neck. Is that okay if I do that?
Yeah.
Okay. Okay, if you could swallow for me. Perfect. Okay, you can turn back to the front. I'm now going to palpate for lymph nodes, and I'm going to name them as I go, okay?
Okay.
Submental, submandibular, tonsillar, pre-auricular, post-auricular, occipital, anterior cervical, deep cervical, posterior cervical, and supraclavicular. All that okay? All right. Next, we're going to move on to the lung portion of our exam. So if you could turn that way, please. And if you could cross your arms over your chest for me. I'm just going to palpate in 4 specific areas. Let me know if this brings you any pain, okay?
Okay.
All right. Now I'm going to place my hands on your back, and every time you feel my hands touch your back, if you could say toy boat for me.
Okay. Toy boat. Toy boat. Toy boat. Toy boat.
Perfect. Okay, now I'm going to percuss on your back. And again, just keep your arms over your chest for me, okay? I'm going to do it in a stepwise ladder pattern. Okay. Now I'm going to auscultate on your back. So every time you feel my stethoscope touch your back, if you could breathe in and out through your mouth for me.
Okay.
I'm going to perform the same stepwise ladder pattern. All right, now I'm just going to place my hands on your back, and then I want you to take a deep breath in, deep breath out, okay? In, out. Perfect, okay? If you could turn to the front, now I'm going to do the same thing that I did on the back, on the front. You can lower your gown, perfect. Now I'm going to palpate in 3 areas. Let me know if this brings you any pain.
Okay.
Everything okay?
Yes.
Okay, same thing, toy boat, every time you feel my hands touch your back.
Toy boat. Toy boat. Toy boat.
Perfect. And while I've been performing this, I've been inspecting your chest, making sure that your diameter is okay, front and back. Okay. Same thing, percuss, I'm going to do in 6 specific areas now. Okay. now I am going to auscultate. Again, breathe through your mouth every time you feel my stethoscope touch your back or touch your chest, okay?
Okay.
All right. Now I'm going to place my hands on your chest. Deep breath in, deep breath out. Perfect. Okay. Now I'm going to lay you back to a 30-45 degree angle and perform your cardiology exam. I'm going to lower it or let this out to make it a little bit more comfortable for you. Okay. Just going to lower you down now. Okay. And I'm going to lower your gown. Is that okay?
Yes.
All right, perfect. Look all the way to the wall on the left. I'm just going to observe your internal jugular vein. And first I'm going to find on your sternum. Next, I'm going to listen on your carotid artery with both the bell and the diaphragm of my stethoscope. And if you could hold your breath while I perform this, I'll let you know when to hold and when you can breathe again, okay? All right, hold your breath. Okay, take a breath. Hold your breath. Okay, let it out. And do the same thing on the other side. If you could look to that wall for me. Okay, hold your breath. Let it out. Okay, hold your breath. All right, let it out. Okay, now I'm just going to palpate your carotid, so same thing towards the wall for me. Perfect, other side. All right. Now I'm just going to palpate on your chest, but before that I'm going to inspect your precordium. Okay. Now I'm just going to place my hands on your chest with both the palm of my hand and the tips of my fingers, looking for heaves and thrills, okay? In 5 specific areas. Okay, now I'm going to calculate your PMI. I'm just going to hold my hand over the left side of your chest. Perfect, okay. Now I'm going to auscultate in 5 specific areas with both the bell and diaphragm of my stethoscope. Alright, that all sounds good. Now you can put your band back up. I'm just going to feel your pulses. So first I'm going to find your radial pulse on it bilaterally. Okay, other hand. Okay, ulnar. Ulnar. Okay, now I'm going to do brachial, so relax for me. Other side. Okay, and if you could put your feet up right here, I'm just gonna do your popliteal. Okay, other side. Okay, you can lay your feet back down. And I'm just gonna put your foot in, find your tibial. Other side. All right, and if you could lift your big toe up for me, I'm gonna find your dorsalis pedis. Okay, you can lower that. Other side, and lower. Okay, last thing, I'm just gonna check for edema, pitting edema, so I'm just gonna press on your bony structures. Okay, I'm just gonna push this back in. And raise you back up. And that concludes our exam.